Good morning, everyone. Welcome to the April 2021 Community Breakfast hosted by the Office of New Haven Affairs. My name is Karen King. Our office hosts these breakfasts on the first Thursday, typically of every month during the academic year. And these are opportunities for you all to meet and learn from members of the Yale community who join us to speak about topics in their areas of expertise. I'm a fan. I always learn something new with every single speaker. I'm sure today will be no exception, and I hope you will as well. I have a few announcements before we get started. I am going to share my wonderful screen with you. One is a reminder that the university created the Yale Community for New Haven Fund in March. As a way to provide funding to local nonprofits who have been supporting New Haven residents who've been negatively impacted by the pandemic. Funding is still available. We do have a webpage with additional information here. I will drop the link in the chat so that you can visit the page, share the information, and share the application link as well, which is here. To date, the university has donated nearly $3 million to New Haven nonprofits, and we've donated to nearly 200 nonprofits who are doing fantastic work. So please help us spread the word, especially for nonprofits who may not have heard about this resource. They can always contact me as well. I'll put my email in the chat. Our office is host to a number of wonderful programs and initiatives. A lot are through our Pathways to Science program. Our Pathways to Science program is a way to introduce New Haven public school students to STEM areas in STEM education and also careers, which is where Medical Mornings comes in. Medical Mornings is one of the many free workshops that the Pathways program offers. Medical Mornings will be presented on Sunday, April 11th from 2 to 3 p.m. The suggestion is for students in grades 6 through 12. And this is a way for students to meet doctors, learn about their pathways through education and in their careers, and also just give general information about their lives. I think it's a really great way to personalize members of the School of Medicine and the work that they're doing, and to show students how they too can become fantastic doctors. The Divinity School is host to a wonderful resource through the Yale Youth Ministry Institute. I'm going to put a link to the Yale Youth Ministry Institute. And so the Youth Ministry Institute provides free workshops, free resources for people to engage youth in their ministry. There is a free Zoom webinar on April 7th from 12 to 1:30 called Adventures in Spacemaking with Reverend Langini. Reverend Langini will provide resources on how regarding language, pronouns, and other queer-related issues. You could also gain insights on simple changes you can make in your own practices to create space for LGBTQ+ youth and others you intend to serve. I think it'll be a wonderful resource for everyone. This is, again, a free event. I will put the link for the registration in the chat. Free, but please register in advance. The Yale Pointer Fellowship and the New Haven Free Public Library are co-hosting Taping Chen. She has written a book called Land of Big Numbers, which is highly acclaimed. She will be visiting New Haven via Zoom from Philadelphia on Tuesday, April 20th at noon. I will put the link to the description in the chat box. Ms. Chen is a wonderful fiction writer. She is widely published and well regarded. And as I said, there's a lot of excitement about her first book to be released soon. And also the Yale New Haven Hiring Initiative is a concerted effort by Yale University to hire New Haven residents for jobs at the university. They do focus on neighborhoods of focus in terms of hiring. There is a webpage on the website for you to get some more information. There is a job listing. There's also a link to Yale's job application proprietary page. So you can get more information here. It's also information for you to contact the team at the New Haven Hiring Initiative. They publish a monthly newsletter that you can also sign up for from here. They will, by the way, be our speakers next month. And so I will look forward to you joining us at that time. So on to our wonderful speakers. So today we have Susan Nappi and Chandra Kelsey. Susan Nappi is the Executive Director of the Office of Public Health Practice at the Yale School of Public Health. With a diverse portfolio in public health practice and research, she has held multiple positions in Connecticut, including Senior Director of Community Impact at the United Way of Greater New Haven, Executive Director of the Community Center for Excellence in Women's Health at Griffin Hospital, and Practice Administrator of the Griffin Faculty Practice Plan. Susan has also managed research teams at the Yale School of Public Health and the VA Alcohol Research Center. Her primary interest is building collaborative, equitable, and mutually beneficial community academic partnerships that espouse a multidisciplinary approach to addressing the social determinants of health. Chandra Kelsey supports the Yale School of Public Health's Office of Public Health Practice, managing student internships, co-leading the Public Health Practice Practicum course, and continuing education through the New England Public Health Training Center. She currently serves on the board of directors for the Connecticut Breastfeeding Coalition. Chandra has partnered with Connecticut Department of Health and WIC on the It's Worth It campaign to promote breastfeeding and community support, and is currently a part of the New Haven Breastfeeding Task Force as a consultant for care. Her other work includes volunteering for COVID-19 vaccine communications for the New Haven Health Department and the City of New Haven, and researching the barriers of data dissemination in a study for the Robert Wood Johnson Clinical Scholars Program Legacy Steering Committee. In January 2020, she was named one of Connecticut Magazine's 40 Under 40. Please welcome Susan and Chandra. Give you a clappy clap.
Thank you for having us, everyone. I'm going to share my screen. So our talk today is our efforts in responding to a pandemic and how we partnered with community. So our Office of Public Health Practice team, our role within the School of Public Health and our missions and values really are tied in with the school's missions and values to foster sustainable and equitable collaborations between students, faculty, and community partners. We serve as kind of the hub for practice-based learning with students and public health workforce education. And we provide opportunities to apply academic training and evidence-based practice to real-world settings. We oversee internships, practice courses, special projects, academic requirements for any practice-based learning, and provide training opportunities for the public health workforce. Our entire team, from our admin to our faculty director, are all practicing public health practitioners. We've all contributed in various ways during the height of the crisis, between coordinating local food delivery, actually on the ground delivering to residents in New Haven for vulnerable populations, advising on public health information sharing and response with a cultural humility lens for the City of New Haven, assisting with local nonprofits and the State Department of Public Health. We've also matched students for applied learning or kind of field work, either in person or virtually, with different agencies needing assistance and response as part of their academic requirement to fill the large need posed by COVID. One project we collaborated on last year and is continuing to grow is the saliva-based COVID testing. And this effort is focused on enabling local schools and learning hubs to try to get life sort of back to normal. Acknowledging this year's past struggles is really important with the pandemic and also the rise of widespread racism and racial violence. It's been a tough year. And I think it's really important to recognize these hardships and threats to society, and also to honor all of the work the essential staff who've worked and remain working tirelessly. But also, I think it's important to highlight the grace and humanity we've seen from people helping one another, as well as the innovations that have come up and continue to evolve, as well as the collaborations that have been born from this trying time. Here's a slide. This is from one of our social media posts. Responding to a pandemic, students excel at contact tracing. At the beginning of the pandemic, we knew that there would be a great need for contact tracing as one of the ways to monitor the spread of disease so we can react. And the state really had a huge volunteer pool they needed to recruit, and we played a part in matching and helping coordinate that effort. So these volunteers got real life professional experience by calling those that were confirmed with a positive COVID result to get their information, share information, and most importantly, to provide empathetic support. This was a really important sort of soft skill that is not so much taught in the classroom, but happens when you actually work with the community. Additionally, we've had many of our faculty and our dean advise schools on reopening safely with developing protocols, looking at HVAC systems, looking at air filtration, and advising schools what they can do, the infrastructure they can put in place to make sure when schools return back, it's done as safe as possible. Susan?
Yeah, so I just want to echo Chandra's thanks for spending some time with you. And I think that this is a great opportunity for us to reflect on where we've been. Maybe all just we hit the year anniversary from the day that our faculty director told us to box up our stuff and go home and work from home. And really the early weeks where we all were just trying to get our footing. We were all just trying to figure out how best to support all of the efforts that were happening and all the ways that we really needed to fight this pandemic. And Chandra talked about contact tracing. So I was thinking we could talk about so many things, so many responses. We can go down many avenues for the story of how we all were forced to work together in a new way. And we'll focus mostly on Saliva Direct today. But one of the things that Chandra alluded to is contact tracing. So really the pillars to fight this pandemic, it required all of our public health arsenal, which was contact tracing, testing, and then of course now vaccination. So when we talk about our prevention pillars, those are the pillars. Now, of course, we know that just because you have good science doesn't mean it's going to get out in the community. And just because you're a scientist doesn't mean that you exactly know how to interface with the community. So we're really fortunate at Yale that we have world-class researchers, world-class science. So when Saliva Direct came out, it was started out as research that was funded by the NBA, right? So if you may have heard these stories out there that our lab, the Grubauer lab, together with Ann Wiley, kind of created this saliva test. And the reason why this was really important was because what Saliva Direct allowed the researchers to do was get around the bottleneck of all of the resources that were required to actually do testing. Expense, we had reagents, so those things that kind of are mixed together to tell if you have SARS-CoV-2 were in short supply. So these researchers kind of retooled their saliva lab to really assess SARS-CoV-2 in saliva. I'm going to make sure I'm not getting ahead of myself. Next slide. So our team. So a little bit of a story here. You'll see all of our faces here. You see, EMD, Ann Wiley, Nate Grubauer. We also see the Office of Cooperative Research, and then our team. So essentially, Nate Grubauer, who is a resident of New Haven and a father to children in the New Haven school systems, was saying, well, I have this amazing resource. We have this amazing resource. How do we make it available to the community? And he admittedly he's fairly new to New Haven and didn't really know the players. And we were connected. So our team has longstanding relationships with the community. And shout out to many of you on this call. I saw Ann Green on the call. She, comes into play later when we work with the steering committee to figure out who best to partner with in the community. So we knew we had this great test, but also how do we get it out there and how do we take the lead of the community? So this is our team right here, and these were the folks really working together to make sure that it went out into the community. So the test that was developed by the researchers was granted emergency use by the FDA. So essentially, why that's so interesting is that a lab within Yale became an arm of the FDA. So right now, the Grubauer Lab has the authority to create more labs that can run this test. So this test is not an off-the-shelf box test. It's basically a set of steps and a protocol that any lab could be set up to do. And that's very important because, you know, we're hearing a lot about vaccines, but really what's going to continue to be important is testing. If you can test, you can isolate cases and you can keep organizations and schools open. So we've been talking about this now, and we're hoping that this continues to be the language that people get used to, that we continue to need tests. So with this emergency use authorization, the NBA wasn't the only place that could get these saliva tests. And this is important because, you know, it's less expensive than the nasal swab. It's also more comfortable. The nasal swab on average is over $100. This testing strategy could be done at the maximum is $25 a sample. So that's a huge cost savings if we utilize this across the nation. And the method has been validated with reagents and instruments from multiple vendors, so it's flexible and it enables testing if some vendors encounter supply chain issues that we were experiencing early on in the pandemic. Next slide. Okay, you have to unmute.
The implications for this in public health practice is that we can test more quickly and identify asymptomatic people. We can do frequent monitoring of infection spread within a community. So in the instance of, say, a school, this could be done daily, several times a week, so on and so forth. The ability to respond quickly to mitigate risk by clear instructions being provided to isolate and quarantine if a case is detected, and it's effective and affordable. On the website on YSPH for the lab, there is a very clear set of reagents and the cost of them, and it's all transparent and broken down to share with the information with the larger scientific community. And there was a partnership with the Jackson Laboratory to explore how to implement the test for a broader audience. And the laboratory already analyzes patient samples for an RNA signature unique to SARS-CoV-2, the virus that does cause COVID-19.
All right, so now I'm going to get a little bit in the weeds just so you can understand this. And, you know, full disclosure, I'm not a scientist. I had to quickly, and that's the value, I think, of being a public health practitioner is, you know, we're systems thinkers. So we're going to take the best science and we're going to work with our scientists and we're going to work with our practitioners. But this is just to give you a little sense of, you know, the problem that Saliva Direct solves. So this shows you, you got the nasal swab, you've got extract RNA, which is one of the important steps and one of the reasons why there were all these bottlenecks, because it's expensive and there are shortages. And then you need to do 3 reactions per 1 sample. So, and people don't really like the nasal swab, let's face it. If you had that done, you know how uncomfortable it could be. Next slide. So this is just a fancy slide to show you that when you compare saliva to the nasal swabs, they're comparable. And there was concern in the beginning that this saliva wasn't sensitive or as specific, but in fact, that was the NBA study actually proved that to not be true. Next slide. So why is Saliva Direct great and so unique? Is that it has, it's authorized, as I shared, by the FDA. It's got 94% sensitivity. Now, sensitivity is the ability to test to correctly identify patients with the disease. And specificity is the ability of a test to correctly identify people without the disease. So you can see that it's pretty high in those ratings. It's not as invasive, as I shared, it's less expensive, and the supply chain issues are not as problematic. and the authorization is available to labs for free. So it's very important for everyone to know that the Group A lab is not making money off of this. This is something that the Group A team has felt the Saliva Direct team feels very strongly about, that this is not a money-making deal. This is something to really help with the pandemic crisis. Okay, next slide. So there's a great website that tells you more if you want to really learn more about the science and understand more about Saliva Direct. There is Yale has a website that can share with you all of that information, and you can learn about how to request. If you're on this call and you're head of a lab, if you want to request authorization, you can absolutely do that as well. Next slide. Okay, it's important to know we're very grateful that the Yale Path Lab actually has authorization to do this, and we're working very closely with them right now, and we'll talk to you a bit about that with the learning hubs. And there are several private schools in the area that are using this, and there's testing for university. UNH is using this, as well as Sacred Heart. Okay, next slide.
Mm-hmm. So some of the partnerships that we've been working with is the New Haven Health Department and the Learning Hubs in New Haven. And we've basically made ourselves available to be in service to them when the need arises. And these learning hubs developed in New Haven as a way to have students that are attending New Haven public schools in K through 9 to attend school virtually at an approved site. And these were set up in low income neighborhoods, and they have a variety of settings. They could be in churches, like Boys and Girls Clubs, stuff like that. And these are important because it reduces the barriers to homes with unstable or no internet access. It's a safe and supervised learning environment, and they will have access to free school lunches, and also to address the social emotional health needs so that students are engaging in a safe way with their peers. And, especially in the low income neighborhoods too, with winter, like to have a warm place to be safe and learn is really important. So it's a citywide grassroots volunteer-driven network that helps support New Haven kids, youth, and families that are experiencing educational inequities during COVID-19. So it provides social support, internet access, enrichment through small cohorts of children. In order to attend, they must be in grades K through 9, registered for New Haven Public Schools. There's a simple online application that's available for families to fill out, and it's completely at no cost. So this is also helpful for parents who need to work and cannot be at home with their children while they were learning online.
Okay, so I'm going to back up just a second about how this came to be, because I find stories are very interesting, and I think that this is a real great example of a strong community academic partnership, in the sense that while we understood the science, we knew that it was really important to get kids into schools. We also understood that it was not our call. So we were really working with New Haven Health Department, the Board of Ed, to really take the lead and introduce the science as they felt it would be valuable and helpful. So early on in the process, we were working very closely with Director Bond and Dr. Dalal to really be in service to the New Haven community. And during those early stages, it's very important to understand there were a variety of competing demands and needs. And we really were in the wings, just saying, we're here to help. We want to know what the best way to do this. And so I presented Saliva Direct at a Center for Research Engagement Steering Committee meeting. I've been a member for over 15 years there in various roles. And it was Dr. Dalal who made the request that we work with the learning hubs and really provide the service to them and provide service to the adults, because we also understood that there were concerns around testing of kids, testing of families, and being tested on. So we wanted to be sure that this was introduced in a way that was palatable and made sense to the community. So We had some enthusiastic responses to testing all the adults, and this funding is coming directly through, it's all paid for through the Grubauer Lab and grants, and all the adults will be given access to weekly testing. So why that's important is we're going to assess the value and utility of this test in a community setting, and then we'll see whether or not we can do it more. We're going to be testing for a long time. The value also of Saliva Direct is that it is resistant to the mutation. So it actually is testing on a part of SARS-CoV-2 that it has nothing to do with the mutation. So it will pick up any mutation of SARS-CoV-2. So that's very important and valuable. So I'm going to present to you some of the questions and answers that came out of our conversations with our community partners, so you can better understand what this program is and really the utility of it. So people will definitely ask about whether the program was voluntary. Yes, we're not requiring or mandating people to utilize this. We're just offering it. Identity is totally protected, that samples are sent in batches to the lab without personal identification. They're not used for other purposes. The data is not sold. It's safe. There's no risk with saliva collection. Next slide. So there are lots of concerns about a DNA test. Obviously, we know now through you can get your DNA tested, see who your ancestors are. No, saliva is tested for the presence of SARS-CoV-2 and then it's discarded. It's not a research study. So the team, Saliva Direct team, Ann and Nate, they did their research on specificity and sensitivity. We're not doing that research anymore, at least not through this. So it is a screening program, and that's very important. And that really separates public health practice from research, right? So screening programs, very important for us to see, is this useful and valuable in a population to test for SARS-CoV-2? Does it really help us with keeping organizations open? And we're not using research information for research. Yes, there are already, there are always possibilities for false results. If you've had a known exposure or symptoms but a negative test, we still are following CDC guidelines, between 10 and 14 days. And there is no cost associated. As I shared, this is being fully funded. Next slide. As I shared, it's a once-a-week test. We have funding for up to 100 individuals a week, which is plenty, far more than we'll need. And I will note that the partners, I should share, the Clifford Beers Clinic has taken a lead role. They actually are the organization that has signed a contract with the Yale Pathology Lab. And they're really the gatekeepers to the community, and they're working closely with the Yale Path Lab. And they're working closely with the YMCA to make sure that these hubs are outfitted with this testing capacity. We wanted to make sure that the testing sites felt comfortable with a positive test. They're working, Clifford Beers has a physician, and they will be notifying through an online system anyone that tests positive. Next slide. So I know we shared a lot of information, so hopefully you got an overview of kind of who we are. Is really hopefully a center that really serves as the nexus for not only experiential learning, but for some of these innovative solutions to public health problems. And then hopefully you learn more about the Saliva Direct test. And now, and our partnership with the New Haven community, specifically New Haven agencies. And now we'd like to open it up to you for any questions that you might have. And you could put them in the chat as well.
You can put them in the chat. You now have the ability to unmute yourself. You can, or you can wave your hand, any and all of the above. Ms. Green, and then Ms. Shaw. Ms. Green, we just need you to unmute yourself. You know what, Ms. Shaw, why don't you go and then we'll wait. That'll give Ms. Green a chance to unmute.
Yeah, well, I guess my question is, and I guess I'm just a little confused. You referenced the community. What is the community? You've identified a community to work with. how did you identify
Right here.
it?
Yeah, that,
You know, and what community did you wind up working with?
yes, that's a great question. We hear that a lot. Who is community? What is community? And I think for our purposes, what we have been doing is we've been partnering with community leaders. We work with New Haven Healthy Start and Green. We work with Community Action Agency, Ema Smith. We worked with New Haven Health Department, Director Bond. So we work with organizations that serve communities directly, and we take their advice around really how do we partner and negotiate? Because, you know, we're not directly working with, we're a school of public health. We're not directly working with community residents. So it's not appropriate for us to go in to a learning hub. It's not appropriate for us to directly interact. We have to rely on our gatekeepers and our organizations that are directly embedded. So I shared with you earlier, and I understand there's a lot of acronyms. We work directly with the Community Center for Research and Engagement. Ann Green's on this call. I think Jerry Smart might be also on this call. We work with multiple gatekeepers who tell us what the best way to partner is, rather than going in and assuming we know best in a community. So in this instance, while we knew that testing was a great thing, we were really relying on Director Bond and Dr. Dalal, the health department, and we were really relying on people like Ann Green to kind of tell us what's the best way for us to partner. So I hear that loud and clearly, that we have to be very careful about how we frame community.
Mhm. Thank you.
You're welcome.
Ms. Green, you will need to unmute yourself.
Okay, I'm not Dottie, but I'm Mildred. And my question to the women is Yale Hospital doing this study or testing, or is Yale University doing the testing for the people?
That's a great question. So right now it's Yale Pathology Lab,
Okay.
which is separate from Yale New Haven Hospital. And the pathology lab is one of the many labs that is authorized to do this, but it's not being done through the hospital.
Okay. And where is your Yale Pathology Lab? Where is that located at?
That's a good question. Let's go back. Chandra, do you have the slide that has the location of the path lab? You think I would know the address, but I don't.
Okay.
Hang on, we'll find it for you.
Pull it.
Okay.
Yeah, if you could find it, Chandra, and put it in the chat. But it's local.
Okay, thank you.
You're welcome.
Any other questions?
I'm going to share with you all a resource that our school has put together. If I could figure it out before I was able to do it. If not, I'll ask Karen to do it on how the School of Public Health has responded to the pandemic. In addition to Saliva Direct, there have been many other contributions locally, as well as nationally, as well as statewide. So it's an interesting story to see how we've all kind of pulled together in unique and new ways. Thank you, Chandra. So these are the locations of all the labs. And I think also on the Saliva Direct website, you can access all where they all are. Thank you. Any other questions? I know we powered through the science very quickly, but as I shared, that's not my forte. We can find some webinars on the Saliva Direct science if you're really interested in learning more about how it compares to the nasal swabs.
I have one more question then.
Sure.
And that is, now how responsive has the public school, the Board of Education or the public school been to this? Because we have a large community of low-income families who benefit from this. And I just wonder, how that's working with, with school and being able to reopen and having face-to-face education, because our kids are not learning with this learning distance, and most of them can't even operate a computer.
Yeah, that is a great question, and I will share that we've already presented to the Board of Ed early on, and we are currently working with the health department to add Saliva Direct to their community testing sites. So we plan on doing that. And I see our dean has his hand up. Do you want to? I'm so happy you're here, Sten. Go ahead.
Well, it's a really important question. For a whole year, Yale School of Public Health has had a team of, I think there are about 6 of us that have been working with schools throughout the state and also in Rhode Island and New York City. And we've been working with public schools, including New Haven, Bridgeport, New York City school system, Rhode Island public schools, and private schools. There's a group called Connecticut Association for Independent Schools, and the Sacred Heart schools in Fairfield County as well. So anybody who's asked for our help, we've been happy to provide that help free of charge. And we've had a team of engineers who focus on air safety, and epidemiologists who focus on strategies for keeping children and staff safe. And we've been able to work with such groups as the Bridgeport school system, New York City school system, to keep them open safely. The private schools have been they've been open the whole time. Unfortunately, New Haven we did 5 school walkthroughs, and we had people, building engineers from all the other schools, join us. But then the school board decided not to open up. So I happen to agree with you. I'm a pediatrician in my first life and an infectious disease epidemiologist in my second. So I had a pretty good background to try to help the schools stay open. And we've been very successful. We've had no classroom outbreaks. We've had some sports outbreaks, but those are largely parents who are not cooperating. But the schools themselves have not been danger zones. In fact, I'll be honest with you, Ms. Shaw, I think the schools are a safer place for the students than back home. They're a more controlled environment. The students are more cooperative with mask use and physical distancing, etc. So I do think that we can operate schools safely and keep them open. And I think that the children who are the most vulnerable are the ones who are hurt the most by not being in school, because they may not have optimized internet connection. They may not have ideal computing. Their parents might be blue collar, and they've got to leave home to go to work. So the upper middle class kids whose parents are white collar, they're working from home, most of them, and they can sort of slip out and help their kids with tutoring and with internet connectivity problems. And so the more isolated kids whose parents are out at work, whose infrastructure is not as good, are the ones who suffer the most by school not being open. So I personally believe the New Haven School Board made a terrible mistake when they chose not to open, because only 6% of all of the kids in the state of Connecticut have been forced to do virtual learning exclusively, with no in-class learning. Only 6%. And that includes all the kids in New Haven, except for some kids with special needs who were allowed to go to school. But the vast majority of kids in our own community were denied an in-class opportunity, and there was a false narrative that it would be dangerous. And we've proven that you can run schools safely. So that was a false narrative then and now, and I've been very personally disappointed, because I care about the kids in our own city. I'm sorry, I've gone on a little too long, but that's my point of view.
And Ms. Shaw, also to further add to that, I think our approach and how we are showing up as a partner is not to be a top-down approach and say, this is what you need, please listen to us, we know best. It's more, we have the resources, we're here for you as you're comfortable, as needed, and let us support you.
Thank
And
you.
I have some hope that the more we show up with Saliva Direct as a really valuable tool in the arsenal, the more uptake we will have. I think that when we show success with the learning hubs, which fingers crossed, the contract was just signed yesterday, I believe, we'll be showing up in the learning hubs. I think we'll show the utility of this test. And I think we'll be able to utilize it in partnership with the health department. And I'm hopeful about that. So, I'm trying to look forward that hopefully the community will understand that the testing is necessary and there will be comfort with it, because it doesn't always feel comfortable to start out with testing. Yeah, so we respected that. I actually had a comment from Anne Green, my colleague, to talk also about and I know we have somebody from the United Way of Greater New Haven on the call. We had a wonderful partnership, just to share about the community partnership. We had a wonderful partnership with the United Way of Greater New Haven to direct all volunteers to one spot on the United Way website. And I sit with a lot of other academic institutions, and everybody sort of was going off in their own directions, trying to sort of, help the community, right? So instead of us doing that, we actually relied on United Way, and United Way worked really closely with the organizations and found one place for everybody to put their urgent needs. And because of that, we were able to really move ahead with some amazing responses to the resurgence of basic needs that happened during the pandemic. And so that was another opportunity for us to really not take a top-down approach. Any other questions, comments, thoughts?
Well, I don't see any hands raised or comments in the chat. So I think you were thorough enough to answer everyone's questions. So with that, we will let you all get on with the rest of your day. I want to thank again Susan and Chandra for joining us this morning, enlightening discussion, and I will send out the link to this recording with the next invitation to our May breakfast. So you will get that soon. So thank you again for joining us. Stay warm, stay well, and we'll see you in May. Thank you, Susan and Chandra.